Question 1. A 29-year-old prima gravida at 33 weeks of gestation is admitted with severe frontal headache, blurred vision, and epigastric pain. Her blood pressure is 172/112 mmHg. Urine protein is 4+, and deep tendon reflexes are hyperactive with ankle clonus present. The fetal monitor shows minimal variability. Which nursing action is the highest priority while preparing for magnesium sulfate administration? A. Encourage ambulation to improve placental perfusion. B. Place the client in a dark, quiet room and initiate seizure precautions. C. Restrict all oral fluids for the next 24 hours. D. Obtain a vaginal examination every 2 hours. Answer. B. Place the client in a dark, quiet room and initiate seizure precautions. Rationale. The client has severe preeclampsia with neurologic irritability indicating imminent risk for eclampsia. Reducing external stimulation and implementing seizure precautions are immediate priorities to prevent seizure activity before magnesium sulfate becomes therapeutic. Question 2. A pregnant client at 36 weeks receiving magnesium sulfate for severe preeclampsia suddenly becomes lethargic. Respiratory rate is 8 breaths/minute. Urine output during the last 4 hours is 80 milliliters, and patellar reflexes are absent. Which intervention should the nurse perform first? A. Increase the magnesium sulfate infusion rate. B. Notify the neonatal intensive care unit. C. Stop the magnesium sulfate infusion and administer calcium gluconate as prescribed. D. Reposition the client onto her right side. Answer. C. Stop the magnesium sulfate infusion and administer calcium gluconate as prescribed. Rationale. The client is exhibiting magnesium toxicity manifested by respiratory depression, oliguria, and absent reflexes. Magnesium sulfate must be stopped immediately, and calcium gluconate, the antidote, should be administered promptly. Question 3. A nurse is assessing 4 postpartum clients. Which client is at greatest risk for developing eclampsia? A. Client with blood pressure 118/74 mmHg and trace edema. B. Client with gestational diabetes and fasting glucose of 96 milligrams per deciliter. C. Client with severe preeclampsia reporting visual disturbances and hyperreflexia. D. Client with mild anemia and fatigue after delivery. Answer. C. Client with severe preeclampsia reporting visual disturbances and hyperreflexia. Rationale. Visual disturbances and hyperreflexia are signs of central nervous system irritation associated with worsening severe preeclampsia and progression toward eclampsia. Question 4. A client with severe preeclampsia at 35 weeks begins having a tonic-clonic seizure. Which nursing action should occur first? A. Insert an oral airway immediately. B. Restrain the client's extremities. C. Turn the client to the side and protect the airway. D. Begin chest compressions. Answer. C. Turn the client to the side and protect the airway. Rationale. During an eclamptic seizure, maintaining airway patency and preventing aspiration are the immediate priorities. Restraints and oral airway insertion during active seizure activity can cause injury. Question 5. A client diagnosed with mild preeclampsia asks the nurse why proteinuria occurs. Which explanation by the nurse is most accurate? A. Protein appears because the fetus compresses the maternal bladder. B. Kidney vasospasm causes increased glomerular permeability, allowing protein to leak into urine. C. Pregnancy hormones directly increase protein excretion in all pregnant clients. D. Proteinuria develops from excessive maternal fluid intake. Answer. B. Kidney vasospasm causes increased glomerular permeability, allowing protein to leak into urine. Rationale. Preeclampsia involves widespread vasospasm and endothelial damage, leading to decreased renal perfusion and increased glomerular permeability, causing protein leakage into urine. Question 6. A laboring client with severe preeclampsia is receiving magnesium sulfate and oxytocin simultaneously. Which assessment finding requires immediate intervention? A. Deep tendon reflexes 2+. B. Blood pressure 148/92 mmHg. C. Respiratory rate 10 breaths/minute. D. Urine output 40 milliliters per hour. Answer. C. Respiratory rate 10 breaths/minute. Rationale. Respiratory depression is a dangerous complication of magnesium sulfate therapy. Respiratory rates below 12 breaths/minute may indicate toxicity, requiring immediate evaluation and intervention. Question 7. A nurse caring for a client with severe preeclampsia notes sudden onset of right upper quadrant pain and worsening nausea. Laboratory studies reveal elevated liver enzymes and thrombocytopenia. Which complication should the nurse suspect? A. Placenta previa. B. HELLP syndrome. C. Gestational hypertension. D. Hypermusie gravidarum. Answer. B. HELLP syndrome. Rationale. HELP syndrome is characterized by hemolysis, elevated liver enzymes, and low platelets. Right upper quadrant pain is a classic finding due to liver involvement. Question 8. A client at 31 weeks gestation with preeclampsia has the following findings. BP 166/108 mmHg, platelets 88,000/mm superscript 3, AST 125 units/L, and persistent headache. Which prescription should the nurse question? A. Continuous fetal monitoring. B. Seizure precautions. C. Intramuscular injection administration as needed. D. Magnesium sulfate infusion. Answer. C. Intramuscular injection administration as needed. Rationale. Clients with thrombocytopenia are at high risk for bleeding. Intramuscular injections can cause hematoma formation and should generally be avoided. Question 9. A postpartum client who experienced severe preeclampsia suddenly reports shortness of breath and coughs pink frothy sputum. Which complication is most likely occurring? A. Pulmonary edema. B. Placental abruption. C. Uterine rupture. D. Disséminated intravasculaire coagulation. Answer. A. Pulmonary edema. Rationale. Pulmonary edema is a serious complication of severe preeclampsia caused by endothelial damage, capillary leakage, and fluid shifts. Pink frothy sputum is a classic manifestation. Question 10. A nurse is teaching a client with preeclampsia about warning signs that require immediate medical attention after discharge. Which statement by the client indicates correct understanding? A. Mild ankle swelling is the most dangerous symptom. B. I should report severe headache or visual changes immediately. C. Frequent urination means my condition is worsening. D. Nausea after meals is expected and not concerning. Answer. B. I should report severe headache or visual changes immediately. Rationale. Severe headache and visual disturbances are warning signs of worsening cerebral involvement and possible progression to eclampsia requiring immediate evaluation. Question 11. A 24-year-old client at 34-week gestation with severe preeclampsia is receiving magnesium sulfate at 2g/HR intravenously. During assessment, the nurse notes the fetal heart rate baseline has decreased from 145 BPM to 110 BPM with minimal variability. Maternal respirations are 9 breaths/minute and patellar reflexes are absent. Which action should the nurse take first? A. Administer oxytocin to improve uteroplacental circulation. B. Stop the magnesium sulfate infusion immediately. C. Increase the fluid rate to improve fetal perfusion. D. Position the client supine to improve blood pressure accuracy. Answer. B. Stop the magnesium sulfate infusion immediately. Rationale. The client demonstrates magnesium toxicity manifested by respiratory depression and absent reflexes. The medication must be discontinued immediately to prevent respiratory arrest and worsening fetal compromise. Question 12. A client with preeclampsia suddenly develops vaginal bleeding, abdominal rigidity, and fetal bradycardia. Which complication should the nurse suspect? A. Placenta accreta. B. Placenta previa. C. Abruptio placentae. D. Chorioamnionitis. Answer. C. Abruptio placentae. Rationale. Severe hypertension associated with preeclampsia increases risk for placental abruption. Painful vaginal bleeding, rigid abdomen, and fetal distress are classic findings. Question 13. A nurse is evaluating laboratory findings for a client with worsening preeclampsia. Which result requires immediate reporting to the healthcare provider? A. Hemoglobin uxitoista tiste kaksi geu decilitra. B. Platelet count 72,000/mm superscript 3. C. Urine specific gravity 1.020. D. White blood cell count 12,000/mm superscript 3. Answer. B. Platelet count 72,000/mm superscript 3. Rationale. Severe thrombocytopenia suggests progression toward HELLP syndrome and significantly increases hemorrhage risk. Immediate provider notification is required. Question 14. A client with eclampsia experiences a seizure lasting 90 seconds. Following the seizure, which assessment finding is the nurse's priority? A. Presence of dependent edema. B. Maternal temperature. C. Airway patency and oxygen saturation. D. Frequency of contractions. Answer. C. Airway patency and oxygen saturation. Rationale. Postictal airway obstruction and hypoxia are immediate life-threatening concerns after an eclamptic seizure. Airway and oxygenation always take priority. Question 15. A nurse is preparing to administer hydralazine to a client with severe preeclampsia. What is the primary therapeutic goal of this medication? A. Prevent uterine contractions. B. Increase fetal heart rate variability. C. Lower maternal blood pressure to reduce stroke risk. D. Eliminat proteinuria rapidly. Answer. C. Lower maternal blood pressure to reduce stroke risk. Rationale. Hydralazine is an antihypertensive used in severe preeclampsia to reduce dangerously elevated blood pressure and decrease risk for cerebral hemorrhage and maternal stroke. Question 16. A client with severe preeclampsia is receiving seizure precautions. Which intervention is most appropriate? A. Encourage bright lighting for neurologic monitoring. B. Keep suction equipment and oxygen available at bedside. C. Ambulate the client every hour. D. Restrict visitors completely for 48 hours. Answer. B. Keep suction equipment and oxygen available at bedside. Rationale. Clients at risk for seizures require emergency airway equipment readily available to manage aspiration and hypoxia during seizure activity. Question 17. A nurse is assessing a client diagnosed with preeclampsia without severe features. Which finding indicates disease progression to severe preeclampsia? A. Blood pressure 142/90 mmHg. B. Trace proteinuria. C. Persistent severe headache unrelieved by medication. D. Mild dependent edema at end of day. Answer. C. Persistent severe headache unrelieved by medication. Rationale. Persistent severe headache indicates cerebral involvement and progression to severe disease, requiring urgent evaluation and management. Question 18. A client receiving magnesium sulfate asks why urine output is monitored so closely. Which response by the nurse is best? A. The medication can accumulate when kidney function decreases. B. Urine output determines fetal lunge maturity. C. Frequent urination indicates worsening hypertension. D. Low urine output shows the medication is working properly. Answer. A. The medication can accumulate when kidney function decreases. Rationale. Magnesium is excreted through the kidneys. Oliguria can cause toxic magnesium accumulation, leading to respiratory depression and cardiac complications. Question 19. A postpartum client who had severe preeclampsia reports flashing lights and increasing headache 12 hours after delivery. Which nursing interpretation is most accurate? A. Symptoms are expected postpartum discomforts. B. The client may still progress to eclampsia postpartum. C. These findings suggest postpartum hemorrhage. D. Visual disturbances indicate oxytocin overdose. Answer. B. The client may still progress to eclampsia postpartum. Rationale. Eclampsia can occur postpartum, particularly within the first 48 hours after delivery. Persistent neurologic symptoms remain highly concerning. Question 20. A nurse caring for a client with severe preeclampsia reviews the following assessment findings. BP sazhetvenyolt sastizanij mmhg. Urine output 25 milliliters per hour. Hyperreflexia with clonus. Severe epigastric pain. Which finding should the nurse identify as the strongest indicator of impending eclampsia? A. Severe epigastric pain. B. Blood pressure elevation. C. Hyperreflexia with clonus. D. Reduced urine output. Answer. C. Hyperreflexia with clonus. Rationale. Hyperreflexia and clonus reflect significant central nervous system irritability and are strong predictors of impending seizure activity in severe preeclampsia. Question 21. A 32-year-old Gravida 2 Para 1 client at 37-week gestation with severe preeclampsia is receiving magnesium sulfate therapy. The nurse notes the following findings during hourly assessment. Respiratory rate, 14 breaths/minute. Urine output, 32 milliliters per hour. Patellar reflexes, 1+. Serum magnesium level, 7 milligrams per deciliter. Which interpretation by the nurse is most accurate? A. The client is experiencing magnesium toxicity. B. The magnesium level is within the therapeutic range. C. The client requires immediate calcium gluconate administration. D. Magnesium sulfate should be discontinued immediately. Answer. B. The magnesium level is within the therapeutic range. Rationale. Therapeutic magnesium levels for seizure prevention generally range from 4 to 7 mg/dl. The client's assessment findings remain acceptable, although continued close monitoring is essential. Question 22. A client with severe preeclampsia is undergoing induction of labor. Which fetal assessment finding is most concerning to the nurse? A. Baseline fetal heart rate of 140 bpm. B. Moderate variability. C. Recurrent late decelerations. D. Accelerations with fetal movement. Answer. C. Recurrent late decelerations. Rationale. Late decelerations indicate uteroplacental insufficiency and fetal hypoxia, which are common complications of severe preeclampsia due to placental vasospasm. Question 23. A nurse is caring for a postpartum client receiving magnesium sulfate after delivery for severe preeclampsia. The client asks why the medication is still needed since the baby has already been delivered. Which response is best? A. The medication is continued because seizures can still occur postpartum. B. The medication prevents postpartum hemorrhage. C. Magnesium sulfate is required to stimulate uterine contractions. D. The drug helps lower proteinuria after birth. Answer. A. The medication is continued because seizures can still occur postpartum. Rationale. Clients remain at risk for eclamptic seizures during the postpartum period, especially within the first 24 to 48 hours after delivery. Question 24. A client with severe preeclampsia suddenly develops confusion, severe dyspnea, and oxygen saturation of 84%. Bilateral crackles are heard on auscultation. Which intervention should the nurse anticipate first? A. Immediate administration of 4 fluids at rapid rate. B. Administration of oxygen and preparation for diuretic therapy. C. Trendelenburg positioning. D. Oncologie orale fluidique. Answer. B. Administration of oxygen and preparation for diuretic therapy. Rationale. The client is likely experiencing pulmonary edema, a life-threatening complication of severe preeclampsia. Oxygen support and reduction of fluid overload are priorities. Question 25. A nurse is reviewing risk factors for preeclampsia with a group of pregnant clients. Which client has the highest risk? A. Multiparous client with no chronic illness. B. Prima gravida client carrying twins. C. Client at 28 weeks with treated urinary tract infection. D. Multiparous client age 24 with normal BMI. Answer. B. Prima gravida client carrying twins. Rationale. Multiple gestation and first pregnancy are major risk factors for developing preeclampsia due to increased placental mass and vascular stress. Question 26. A client with eclampsia is actively seizing. Which prescription should the nurse question? A. Maintain oxygen via face mask. B. Insert tongue blade during seizure activity. C. Administer magnesium sulfate loading dose. D. Position client laterale. Answer. B. Insert tongue blade during seizure activity. Rationale. Nothing should be inserted into the client's mouth during an active seizure because this can cause trauma, airway obstruction, aspiration. Question 27. A nurse is caring for a client diagnosed with HELLP syndrome. Which laboratory finding would the nurse expect? A. Elevated platelet count and low liver enzymes. B. Increased hemoglobin and low bilirubin. C. Elevated AST and decreased platelet count. D. Low hematocrit with normal liver enzymes. Answer. C. Elevated AST and decreased platelet count. Rationale. HELLP syndrome is characterized by liver dysfunction and thrombocytopenia. Elevated liver enzymes and low platelets are hallmark findings. Question 28. A client with severe preeclampsia reports sudden worsening headache and blurred vision. Blood pressure is now 186/118 mmHg. Which action should the nurse prioritize? A. Provide oral analgesics and reassess in 1 hour. B. Prepare the client for possible emergency delivery. C. Encourage ambulation to lower blood pressure. D. Delay intervention until laboratory results return. Answer. B. Prepare the client for possible emergency delivery. Rationale. Worsening neurologic symptoms and critically elevated blood pressure indicate severe disease progression with risk of maternal stroke and seizure. Delivery is often the definitive treatment. Question 29. A nurse receives report on 4 antepartum clients. Which client should the nurse assess first? A. Client at 30 weeks with BP 138/86 mmHg and mild edema. B. Client at 39 weeks requesting pain medication during labor. C. Client at 34 weeks with severe preeclampsia reporting epigastric pain. D. Client at 28 weeks with controlled gestational diabetes. Answer. C. Client at 34 weeks with severe preeclampsia reporting epigastric pain. Rationale. Epigastric pain suggests hepatic involvement and possible progression to HELLP syndrome or impending eclampsia, making this the highest priority assessment. Question 30. A nurse is educating a client with preeclampsia about home monitoring. Which statement by the client requires further teaching? A. I will monitor fetal movement daily. B. I should report sudden swelling of my face or hands. C. Persistent headaches should be reported immediately. D. Bed rest alone will completely prevent progression to eclampsia. Answer. D. Bed rest alone will completely prevent progression to eclampsia. Rationale. Although rest may reduce stress and blood pressure, preeclampsia can still progress despite bed rest. Continuous monitoring and medical management remain essential. Question 31. A 27-year-old client at 35 weeks gestation with severe preeclampsia is admitted to the labor unit. The nurse notes increasing agitation, severe headache, photophobia, and 4+ deep tendon reflexes with sustained ankle clonus. Which nursing intervention is the highest priority? A. Encourage the client to ambulate to decrease anxiety. B. Prepare the client for immediate breastfeeding education. C. Reduce environmental stimulation and maintain seizure precautions. D. Place the client in high Fowler's position for comfort. Answer. C. Reduce environmental stimulation and maintain seizure precautions. Rationale. Hyperreflexia, clonus, headache, and photophobia indicate severe sinus irritability and impending eclampsia. Minimizing stimulation and instituting seizure precautions are immediate priorities. Question 32. A nurse is caring for a client receiving magnesium sulfate for severe preeclampsia. Which assessment finding most strongly indicates therapeutic effectiveness of the medication? A. Decreased blood glucose level. B. Absence of seizure activity. C. Increased urinary protein excretion. D. Elevated fetal heart rate baseline. Answer. B. Absence of seizure activity. Rationale. Magnesium sulfate is administered primarily to prevent seizures in clients with severe preeclampsia and eclampsia. Question 33. A client with severe preeclampsia develops disseminated intravascular coagulation, DC. Which assessment findings should the nurse expect? A. Excessive clotting without bleeding. B. Petechiae, oozing from 4 sites and prolonged bleeding. C. Bradycardia with hypertension. D. Elevated platelet count and dry mucous membranes. Answer. B. Petechiae, oozing from 4 sites and prolonged bleeding. Rationale. DSE causes widespread coagulation factor consumption, leading to uncontrolled bleeding manifestations such as petechiae and bleeding from puncture sites. Question 34. A nurse is caring for a client with severe preeclampsia whose blood pressure remains 170/110 mmHg despite treatment. Which maternal complication is the client at greatest immediate risk for? A. Cerebral hemorrhage. B. Hyperemesis gravidarum. C. Cholecystitis. D. Iron deficiency anemia. Answer. A. Cerebral hemorrhage. Rationale. Severe, uncontrolled hypertension significantly increases the risk of stroke and intracranial bleeding in preeclampsia. Question 35. A client with eclampsia has just completed a seizure episode. Which physician prescription should the nurse implement first? A. Obtain a clean catch urine sample. B. Begin magnesium sulfate infusion. C. Assist the client to ambulate. D. Initiate oral antihypertensive therapy only. Answer. B. Begin magnesium sulfate infusion. Rationale. After stabilization of airway and breathing, magnesium sulfate is the priority medication to prevent recurrent seizures. Question 36. A nurse is evaluating fetal status in a client with severe preeclampsia. Which finding most likely reflects chronic uteroplacental insufficiency? A. Large for gestational age fetus. B. Polyhydramnios. C. Intrauterine growth restriction. D. Fetal tachycardia after movement. Answer. C. Intrauterine growth restriction. Rationale. Vasospasm and reduced placental perfusion in preeclampsia decrease oxygen and nutrient delivery, causing fetal growth restriction. Question 37. A client receiving magnesium sulfate reports feeling extremely warm and flushed shortly after initiation of the infusion. Which response by the nurse is most appropriate? A. This indicates a severe allergic reaction. B. This is an expected side effect of magnesium sulfate. C. The medication must be stopped immediately. D. This finding suggests worsening eclampsia. Answer. B. This is an expected side effect of magnesium sulfate. Rationale. Warmth, flushing, nausea, and lethargy are common expected side effects of magnesium sulfate and do not alone indicate toxicity. Question 38. A nurse is reviewing laboratory data for a client with preeclampsia. Which finding suggests worsening renal involvement? A. Creatinine level of 1.9 milligrams per deciliter. D. Hemoglobin caxitoistatiste neliege u decilitra. C. Platelet count 210,000/mm superscript 3. De has level 22 units. Answer. A. Creatinine level of 1.9 milligrams per deciliter. Rationale. Elevated creatinine reflects impaired renal perfusion and kidney dysfunction associated with severe preeclampsia. Question 39. A client with severe preeclampsia is receiving continuous fetal monitoring. Which fetal heart tracing finding requires immediate nursing intervention? A. Moderate variability with accelerations. B. Baseline heart rate of 135 BPM. C. Repetitive prolonged decelerations. D. Occasional fetal movement. Answer. C. Repetitive prolonged decelerations. Rationale. Prolonged decelerations indicate significant fetal hypoxia and compromised placental perfusion requiring urgent intervention. Question 40. A nurse is caring for a postpartum client 18 hours after delivery complicated by severe preeclampsia. Which assessment finding should the nurse report immediately? A. Blood pressure 150/92 mmHg. B. Deep tendon reflexes 2+. C. Complaint of new-onset visual disturbances. D. Mild dependent edema. Answer. C. Complaint of new-onset visual disturbances. Rationale. Visual disturbances postpartum may indicate worsening cerebral edema or progression to postpartum eclampsia and require immediate evaluation. Question 41. A 30-year-old client at 32-week gestation with severe preeclampsia is admitted to the high-risk obstetric unit. The nurse notes increasing edema, complaints of seeing spots, and a blood pressure of 182/116 mmHg. Which assessment finding would indicate the client is progressing toward eclampsia? A. Deep tendon reflexes 1+. B. Generalized tonic-clonic seizure activity. C. Blood glucose level of 108 milligrams per deciliter. D. Fetal heart rate baseline of 140 BPM. Answer. B. Generalized tonic-clonic seizure activity. Rationale. Eclampsia is defined as the onset of seizures in a client with preeclampsia that cannot be attributed to another neurologic cause. Question 42. A client with severe preeclampsia has been receiving magnesium sulfate for 12 hours. Which assessment finding indicates the need for immediate intervention? A. Urine output 18 milliliters per hour. B. Respiratory rate 16 breaths/minute. C. Patellar reflexes 2+. D. Serum magnesium level 5.8 milligrams per deciliter. Answer. A. Urine output 18 milliliters per hour. Rationale. Oliguria can lead to magnesium accumulation and toxicity because magnesium is excreted renally. Urine output below 30 milliliters per hour is concerning. Question 43. A nurse is teaching a newly licensed nurse about differences between preeclampsia and eclampsia. Which statement by the newly licensed nurse indicates correct understanding? A. Eclampsia is characterized by hypertension without proteinuria. B. Preeclampsia includes seizure activity as a diagnostic feature. C. Eclampsia occurs when a client with preeclampsia develops seizures. D. Preeclampsia occurs only during the postpartum period. Answer. C. Eclampsia occurs when a client with preeclampsia develops seizures. Rationale. The defining difference is seizure activity. Eclampsia represents progression of preeclampsia to seizure occurrence. Question 44. A client with severe preeclampsia suddenly complains of severe chest tightness and dyspnea. Oxygen saturation falls to 82%. Which complication should the nurse suspect first? A. Pulmonary edema. B. Placenta previa. C. Hyperglycemia. D. Uterine atonie. Answer. A. Pulmonary edema. Rationale. Pulmonary edema is a life-threatening complication of severe preeclampsia caused by endothelial leakage and fluid overload. Question 45. A nurse is caring for a client receiving 4-hydralazine for severe hypertension secondary to preeclampsia. Which finding indicates the medication has been effective? A. Blood pressure decreases from 176/108 mmHg to 148/92 mmHg. B. Urine protein changes from 3+ to 2+. C. Deep tendon reflexes become absent. D. Fetal heart rate increases to 180 bpm. Answer. A. Blood pressure decreases from 176/108 mmHg to 148/92 mmHg. Rationale. Hydralazine is administered to lower severe blood pressure and reduce risk for maternal stroke and organ damage. Question 46. A nurse is prioritizing care for 4 antepartum clients. Which client should be assessed first? A. Client with gestational hypertension reporting mild nausea. B. Client with severe preeclampsia and sudden decreased level of consciousness. C. Client at 38 weeks requesting epidural analgesia. D. Client with controlled diabetes reporting hunger. Answer. B. Client with severe preeclampsia and sudden decreased level of consciousness. Rationale. Altered level of consciousness may indicate cerebral edema, impending seizure, or intracranial hemorrhage and requires immediate assessment. Question 47. A client with HELLP syndrome asks the nurse what the LP portion of the disorder means. Which response is most accurate? A. It refers to low perfusion. B. It means liver pathology. C. It stands for low platelets. D. It refers to latent preeclampsia. Answer. C. It stands for low platelets. Rationale. HELP syndrome stands for hemolysis, elevated liver enzymes, and low platelets. Question 48. A client with severe preeclampsia is receiving seizure precautions. Which intervention is inappropriate and should be corrected by the charge nurse? A. Patting the side rails. B. Maintaining a quiet environment. C. Keeping emergency airway equipment nearby. D. Encouraging frequent stimulation to assess neurologic status. Answer. D. Encouraging frequent stimulation to assess neurologic status. Rationale. Excessive stimulation can precipitate seizures in clients with severe preeclampsia or eclampsia. Question 49. A postpartum client treated for eclampsia begins bleeding excessively from venipuncture sites and develops petechiae. Which complication should the nurse suspect? A. Placental abruption. B. Disseminated intravascular coagulation. C. Acute pyelonephritis. D. Hypermesie gravidarum. Answer. B. Disseminated intravascular coagulation. Rationale. Bleeding from puncture sites and petechiae are classic manifestations of DC, a severe complication associated with eclampsia and HELLP syndrome. Question 50. A nurse is providing discharge teaching to a client recovering from severe preeclampsia. Which statement by the client indicates the need for further teaching? A. I will keep my postpartum follow-up appointments. B. I should seek care if I develop headaches or vision changes. C. Once the baby is delivered, I can no longer develop seizures. D. I need to monitor my blood pressure after discharge. Answer. C. Once the baby is delivered, I can no longer develop seizures. Rationale. Postpartum eclampsia can occur after delivery, especially within the first 48 hours, so ongoing monitoring remains essential. And that wraps up our 50 NCLEX Preeclampsia versus Eclampsia Made Easy Questions OB review. If these questions challenge your critical thinking, that's exactly the goal, because the NCLEX loves testing maternal emergencies, seizure precautions, magnesium sulfate toxicity, HELLP syndrome, and prioritization under pressure.